All right, folks. Good morning or afternoon, depending on where you are. Thanks for tuning in today. This session is called Home Healthcare, a No-Brainer. I promise by the end of this webinar, you'll agree on two things. This absolutely belongs in your portfolio, and it needs to be in every client conversation moving forward. I don't care if you sell Medicare, life, annuities, long-term care, short-term care. This fits across the board. And before we begin or dive in, let me set the stage with who Golden Care is because context matters. We've been around since 1974, and that's not a typo. We've survived more product cycles, carrier exits, and rate increase letters than most of us care to remember. A little bit before my time, but for the prehistoric employees here. um, and our model is simple. Identify the unmet need. We partner with the top rated carriers, build solutions agents can actually sell, not just talk about. And home healthcare is exactly one of those unmet needs. So, quick housekeeping, no need to take frantic notes. These slides will be shared. This is being recorded, and we will provide the recording after we wrap up. And if you're not contracted yet, that's fixable. Just call us. And yeah, we actually pick up the phone when you call us. And also, if you have not joined our LinkedIn STC group yet, you're missing out on real practical sales strategies, the latest industry updates, and useful marketing pieces we provide. So why agents partner with us? Well, typically agents don't fail because they lack desire. They fail because they lack Golden Care as their back office support. So here's the real value of partnering with us. We're not here just to get you appointed with the products. We're here to help you build a portfolio that grows and protects your book. So how do we do this? We have the perfect portfolio of products. You need options because your clients don't come in one flavor. Some are healthy, some aren't, some are money, some are middle income, and some are one bad diagnosis away from their retirement plan turning into a GoFundMe. And home healthcare is one of the most streamlined ways to plug that gap, especially when underwriting or pricing knocks them out of the other extended care products. We also have superior back office support. Got to brag a little bit there. So let me translate that. When you call us, you don't get trapped in the voicemail purgatory and you get humans on the line, actual humans with a pulse. We have not been replaced with AI, so take advantage of the real human contacts we have here. Product and sales training, because product knowledge alone doesn't sell policies. We got the sales training to back that up. Those strategies, we train you on what to say, when to say it, how to position it, and how to pivot when a client hits you with the classic objections like, I'll think about it. And of course you will. Thinking is free, care is not. So we'll help you get past that. And we also have some tools that we developed here. Take a look at that lineup, InstaPivot, our underwriting concierge, comparison tools, decon placement program. It's everything that reduces that headache for you, the agent. Because here's the truth, agents don't want more work. They want more placement with less hassle. So there you have it, folks. Golden Care is the no-brainer. All right, enough about us. Let's talk about the elephant in every client conversation. Standalone home health care. Quick show of hands, mentally, of course. How many times have you heard a client say, oh, Medicare will cover that? So we know Medicare covers a lot of things, but it does not cover the thing clients think that it covers, ongoing help at home with the day-to-day stuff. So Asian clients, their default plan is, oh, I have adult children to step in, even if they live 45 minutes away, or their spouse becomes the caregiver. A neighbor checks in. A friend from church brings meals, and somebody ends up managing meds, meals, transportation, and bathing help by also trying to manage their own lives. So this is exactly why home health care belongs in your portfolio, because it gives families options and keeps your clients where they prefer to be, at home. So the next few slides, we're going to connect the dots. between the likelihood of needing care, the trapdoors clients hit in coverage, and how these home health care plans support the real world care team, their family, friends, and professionals without wrecking the household finances. Okay, so let's start with the data because once you see it, you'll never treat home health care like just extra again. Look at these stats. 70% Americans who reach age 65 will need some form of long-term care, and that can be in also a home care setting, assisted living, or nursing care. Care is most often delivered at home. Currently, 3.3, actually this is from 2022, so it's actually higher now, but 3.3 million Americans receive services from home health agencies in a single year. And it's over 12 million US adults aged 65 plus receive some form of home care annually. And again, Medicaid and Medicare don't cover those ongoing custodial home care costs. And then here's the wave. By 2030, 1 in 5 Americans will be age 65. So there's a lot of opportunity out there for you, the agent, to address these needs and get them set up with a solid safety net. In Alzheimer's and dementia, the prevalence is projected to rise significantly. So here's the takeaway. 70% of clients are going to face a care event, and most of that care starts at home again. Then home health care is no longer a nice to add on, it's a no-brainer. And alrighty, attention all Medicare agents. Well, all of you in the senior sales market. If you're new to the game and unaware of the moon notice, let me paint you a quick picture here. So let's say your client has a fall, car accident, minor stroke, something common. You spend 2 nights in the hospital. Then a case manager walks in with paperwork, the moon notice. That notice is required when someone has been under observation as an outpatient for more than 24 hours and it's delivered within 36 hours. So the family thinks, they say, okay, but they're in the hospital, so they're admitted, right? Not necessarily. Observation is generally billed under Part B, which that includes cost sharing and 20% coinsurance for many of the hospital services. And sometimes meds during observation get treated differently than people expect as well. So next up, the discharge planner comes in and says, you may need rehab. Family says, great, Medicare covers rehab. And here's the moment the SNF or skilled nursing that focuses on short-term rehabilitation coverage usually requires a 3-day inpatient stay. An observation does not count towards that. So family's plan A evaporates, and plan B becomes who can be with mom and dad at home, who's taking off work. And on top of that, Medicare home health care is limited. It's intermittent part-time and doesn't cover custodial ADL care, and that's typically the main need. This gap is where these home health care policies, they solve this gap. They don't replace Medicare, they complete the plan. And let's factor in that cost that comes along with it. Talk dollars, because money speaks. Looking at $30, these are the 24 to 2026 national averages. $30 an hour median cost for home health care needs. We're looking over a little over $5,000 a week for 24/7 care, and that can turn into over $20,000 a month for full-time care. So ask your clients this. How long does your savings last if this starts tomorrow? And I'm willing to bet after that question, you're going to hear crickets and reality sets in, eyes widen a little bit. Don't let your clients get to this point. When they say, I wish I would have had something in place, you can help them now to prevent this. Okay, let's look at the ideal target market. 50 to 89 middle income, your homeowners that value their independence. And I know that's kind of a wide range. They typically start these policies between 40 and 89 for issue ages. Typically 40-year-olds really aren't thinking about it yet, it's a harder sell. So that aging in middle income retirees, they have too much to lose to ignore the risk and not enough to self-fund. Also, anyone decline or price out of LTC, this is the easiest conversation, honestly, to pivot opportunity you might have. The client has already raised their hand and said, I understand the care risk, but they have health ailments holding them back from comprehensive coverage or simply they just can't afford it. Then we have your MA clients, like practical benefits and predictable costs. Home healthcare is so affordable that I guarantee it'll certainly appeal to this crowd. And on top of that, you can position it as utilization of that extra savings that they have, from switching to an MA policy and, create a home healthcare safety net. We got those clients with chronic conditions. They most likely understand the need for home health care is right around the corner. And our solo agers, who don't have that, what they believe, the built-in caregiver team that many people lean on. So when to introduce the product. Medicare supplement or Medicare Advantage enrollment, you're already talking about coverage, just widen the lens from, medical bills to recovery at home. And any long-term care declines, if you're doing declines and not pivoting, or if you're experiencing declines and not pivoting to home health care, this is a missed save. You can save that sale. It's that kind of the plan B that clients actually accept. And your retirement income planning, for your financial advisors out there, because retirement doesn't just come with the worry of income, also the possibility of near declining health. So, no home health care in place results in direct impact on those retirement savings. And then extended care eligibility conversations. Say you find yourself in a meeting with a client that has a chronic condition like diabetes, COPD, cardiac problems, or mobility issues, all of which are very common. And those are future need at home health indicators. So paint that picture for them. And annual policy reviews. This is the simplest one. It's the annual what's changed conversation. Something typically always changes. And last one I want to add here is your existing long-term care book for you long-term care writers. You think about that 90-day certification period that long-term care requires to access any of your benefits, where a doctor has to certify that your client's going to need care for at least 90 days to even start a claim. So you can supplement their existing long-term care policy with the home health care plan. In the event they begin care at home, they get cash, day one, no certification requirement. This can also be used to, during those elimination periods. Typically, we see a lot of long-term care plans with that 90-day elimination period. Excuse me. So, all right, now that you know who to call after I wrap up this webinar, let's take a look at the key selling points for those calls. So this is why I call home health care a no-brainer. Affordable premiums, strong benefits without the traditional long-term care price tag. Focus where 80 to 90% of clients prefer to receive care in their own home. Simplified underwriting. Some of these plans just have 2 underwriting questions or knockout questions. Fast approvals, close more sales, serve those clients' urgent needs. Apologize, back up here. Flexibility. Daily or weekly home care benefits, they can start using right away. They're paid as indemnity. And it's perfect for those I waited too long client. They can still get meaningful protection even late in their extended care planning. So bottom line, home health care fits in almost every client conversation. If you don't mention it, someone else will. I feel like this slide says it all. If you don't bring up home health care, another agent will. So you can take that to the bank, deposit it. Now I want to shift gears and look at what Golden Care has recommended as far as our go-to products in the home healthcare arena. Top selling products would be GTL's short-term home healthcare, Manhattan Life's Home Healthcare Select, and Aetna's Home Care Plus. I got a state availability map here. Again, these slides will be shared, so you will have this to use to see exactly where each plan is available. And I don't want to go deep into the plan details today, but I just kind of wanted to show just a outline of them. Product highlight, here's GTLs. GTL and Manhattan Life are kind of set up similar where they have 3 different plan options to choose from. And then there's, a daily maximum depending on the type of care that they're receiving. And a product highlight with this one is GTL's got that T-Care family caregiver benefit. It's a $3,500 lump sum that's paid directly to, family or friends. And I created a couple real life stories because I feel like these really resonate with you agents. A good scenario when to approach or to sell one of these products. So first up, we have Herlinda. She's 72 years young and she had a minor stroke. She goes to the hospital and everyone thinks, okay, admitted, covered, rehab, easy. Plot twist, she's put on observation status and she gets that moon notice. Surprise, you're outpatient. Literally, moon is the only time your client becomes an outpatient or considered outpatient while still wearing that hospital bracelet. So now she's got plan B cost sharing, and here's the real kicker. Because she wasn't an inpatient for the stay, she doesn't qualify for the SNF rehab coverage. So the hospital sends her home with PT, RN follow-ups, assistance with their ADLs, which is exactly where families discover their care becomes their plan of care. My daughter or son will figure it out. And the costs that Linda was staring at without coverage were, a median at $30 an hour nationally for home health care services, 40 hours a week. She's receiving care, $4,800 a month that accumulates to. And with that 24/7 coverage, that can get up to $20,000 a month. That's a lot. I don't know how many people out there I know there's people out there that can afford it, but that's a huge impact on people's savings. But this is where you offered Herlinda a GTL short-term home health care policy, and this is how GTL earns its paycheck and saves the day for Herlinda and her adult children. So she has a rotating schedule of therapy and aid. Her policy ends up paying a total of $12,000 over 40 days. She also got that T-Care that's built in, support the daughter or son caregiver with that lump sum of $3,500. And that's huge because caregiver burnout is real and love doesn't come with PTO. So this is one example of how you can save the Herlindas out there with a standalone home health care policy. Let's take a look at the next one, Manhattan Life Home Healthcare Select. Similar setup, but different benefit amounts. We have the classic Premier Deluxe. This one, I would say, has the most lenient underwriting to health questions to be eligible. And that's just, are you currently receiving care, need assistance with your ADLs? And this slide, I believe most of you have been waiting for. Manhattan Life Home Healthcare Select has been enhanced, and we anticipated the release mid-April, so right around the corner, my friends. And here's what's coming: more flexibility, stronger RX value, longer home health care aid coverage, going up to 360 days from the current 60. And then they also have this homemaker benefit. So think of like the Fast 50 for those of you that are familiar with Omniflex. Clients can receive home help at home from their loved ones, neighbor, or friends. There's different benefit options or daily benefit options within there. And again, that RX is going up to $900 from the current $600. And they're also updating the 90-day prescription reimbursement. Mentioned the home health care aid. That's going to be, they have options of 50, 100, and 150. So overall, this is a meaningful upgrade that makes an already strong plan even easier to position, easier to place, and harder for clients to say no. So stay tuned. We are going to be hosting a webinar that's specific to this product. I'm going to go a deeper dive into the details. And here's our life story of Doris. She was suddenly walking across her front porch, which turned into a high risk activity. She probably lives in Minnesota. She slips on ice, breaks her hip, gets it repaired. And here's the part I want you to catch. Doris doesn't want a facility. Again, that's 89% of people prefer to cover at home. Now, if Doris were to be paying out of pocket, we're talking roughly $28 to $35 an hour, which puts her near the $4,800, $5,600 a month. So without home health care coverage, she would basically, just found herself a new mortgage payment. But you, the agent, you sold Doris a Manhattan Life Home Health Care Select Plan. So she has a safety net to offset those costs. And in this example, she purchased a Premier policy, so that pays up to $300 a day on the service days when she receives her physical therapy and occupational therapy services. She also receives an additional $80 a day for her home health care aid support. So she regained her independence by week 12, and her benefits will restore after 180 days for future use. So I consider this a real win. She saved her home dignity and savings protection overall. And last up for products, we have our Aetna Home Care Plus plan. This one's set up a little bit differently. They do a weekly benefit. You can go up to $1,500 a week, and the covered weeks you can go up to 52 weeks. There's waiting period 0 to 20 days. And let's just take a look at, Aetna, real quick, product highlight. It's got the name recognition, so that lowers the resistance of skeptical buyers. And we have Robert here. We're gonna wrap up our stories with Robert. He is 76. He receives a lymphoma diagnosis that comes with outpatient chemo, a couple ER visits, and he's home with, nursing checks, med management, and aid support several days a week. Here's the gap again. Medicare can cover certain intermittent medical home health care needs, but doesn't pay for extended custodial help with the ADLs. And that's exactly, when families start to scramble for, assisting them during their recovery. But he does have an Aetna Home Care Plus that pays indemnity cash for the covered home care and hospital days. Again, you can select up to $400 a day for the hospital coverage, and he's got $1,500 a week for healthcare services. And he also gets a lump sum. He purchased the rider. Each of these plans have different riders that you can select from, and in this scenario, he selected a lump sum cash benefit rider that for cancer diagnosis. And Aetna has you could choose between 2,500, 5,000, or 10,000. So I can, a lot of us probably will end up with some form of cancer, unfortunately, in this day and age. So it's a really nice rider to add on. And again, here we see that standalone home health care saves another real life health event. All right. So why this standalone home health care, why these policies are a no-brainer? For the client, they get to stay at home, protect their savings, minimize that family burden, affordable, simple to qualify for. Why is it no-brainer for agents? Well, you have a lot of cross-selling opportunity, higher close rates, easy to deliver and explain product, and you're protecting clients where they prefer to recover at home. Bottom line, home health care is not optional anymore. It's affordable, it's needed, it sells, it saves families. So call me to get appointed, get paid, because home health care sells, serves, and certainly has a place in the extended care market. And that's a wrap, folks. Before you go, here's the dream team behind the scenes. You got questions, quote requests, underwriting, sales tips, product training, you name it, we got it. You can call us at 800-842-7799. And keep an eye on your inbox. You'll be receiving your CE voucher, full copy of today's slides, the recording, Use them, share them, build with them. Short and sweet, but any questions you guys have, or if you want to, dive deeper into any of the products details, call us. And always, as always, remember, you're never alone. You partner with Golden Care. Thank you, everyone. You take care for now.
Golden Care is always here to serve you with new tools, new products, new ideas, and new innovations, and always the best support in the business to help you succeed. So give us a call at 800-842-7799 and check out our website at www.goldencareagent.com.